And what was the turning point that made you come to Nepal here in NCOMS?
Yeah, that is a very interesting question.
So let's suppose if we had time machine, so we are going to time travel a lot, sir, in this session. Yes,
Whatever.
was it love at first sight or what?
Was there ever a case in your research or patient care that left you completely speechless? Like you were surprised by micro. You have taught thousands of students. Among them, if I ask you one student, whose face you remember, will spark you, sir?
Of course, within her syllabus, she answered 100%.
What was one hardest question you were asked by the student and you pause and think like, I need to read more?
These 2 times I have failed.
Actually, I love my patients, but I hate the micro. So, main motivation are the students.
What is your relation with ex-president of Nepal, Dr. Niranjan, sir?
Yes,
Tell us some.
मुझे इतना ना सताओ, अब चैन से रहने दो, मेरे पास ना आओ.
Suppose if you had the chance to meet Luis Pasteur, let's say, or meet or WhatsApp him, so what would be the message that you would like to send him? If you had not been a microbiologist, what alternate life would you be living right now? Which is more dangerous, antibiotic resistance or heartbreak?
Hello and welcome to today's episode. We are truly honored to have with us a very special guest, a name that needs no introduction in the field of microbiology. Truly inspiring journey from a small village to PGI Chandigarh, then AIMS Delhi, and finally shaping future doctors including us and at Manipal Teaching Hospital, Pokhara. He is not just a renowned teacher and researcher, but he is a mentor who is admired by thousands of students. So first of all, before starting this episode, I would like to be thankful to our respected sir. It's our privilege to have him in our podcast. So let's give warm welcome to our respected Dr. Niranjan Nayak, sir.
Thank you so much. I am really happy and delighted to participate in this event. You have organized in a nice way. So let us proceed.
Okay, sir, this day is very special for us, as auspicious day, and thank you for accepting our request for this interview. So, since we are in this microbiological ambience, let's call it quorum sensing, sir. So, let's begin with your childhood. Okay, sir.
Okay. So I was born in a small village in a district called, the then district was Cuttack district. So I was born there in a village and I had my schooling in a nearby high school. So I was, throughout my high school career, I was the topper in the school and I was very good in mathematics and I got first division in, at that time, it was 11th class and they used to call it high school certificate examination, matriculation examination. So I scored very high marks and I got a national scholarship. Then I came to Bhubaneswar for my intermediate science, and that was the juncture when there was some confusion because I was very good in mathematics also in the college. So everybody advised my seniors, my brothers, they advised me, you go for engineering. I was also good at literature, and during those days there was a craze for people after studying science. They used to come to literature and compete for administrative jobs in the India government service. So that was another option. So after passing my intermediate science, it was a holiday. I didn't come to my village. I stayed in Bhubaneswar, and there was my mentor, my brother-in-law, husband of my cousin elder sister, with whom I spent, it was almost a whole night discussion. And in the early morning, we came to conclusion that I will opt for medical, MBBS. So that time there was no entrance examination in our MBBS. It was purely selected on the basis of merit, and on the basis of merit you are selected onto the best medical college, next best, like that. So I got my seat in Sri Ramchandra Bhanja Medical College, SCB Medical College, Cuttack. So then I studied MBBS. Then after that, due to because there was no job for doctors at that time in Odisha, scarcity. So I joined Coal India Limited, a central government undertaking. I worked there. But there I was not at all happy. So I started applying for my post-graduation here and there in different colleges. As you were saying, I had my MD degree from PGI Chandigarh, but it was not that easy. I tried in many medical colleges in many states of India, but I do not know. I'm surprised I could not be successful. So ultimately, there was an advertisement for PGI Chandigarh, and as I was serving in a very rural belt, coal fields, so I had almost forgotten whatever advancement had occurred in science, in medical science especially. Still then, I used to go, there was a small library in one central government hospital building, inside their building. It was not a teaching hospital, it was a hospital. So there was a small library. I used to go in the evening Delhi after my general duty medical officer's job. I used to go and study there. And somebody told that you read Harrison, this thing. Books were available. I studied and prepared for my entrance. So luckily, I came through in the PGI entrance examination and also in the departmental viva voce examination. So I completed my MD there, 3 years MD course. But to become a faculty member in AIMS, PGI and ZIPMER, you have to have 3 years of teaching experience after your MD. Post-graduation is 3 years, another 3 years of teaching experience to be eligible to apply. So I continued my senior residency there. So my boss, HOD Microbiology, was very happy. And but when we were two of us, when we were about to complete our senior residency, posts were there, but there were some political issue. The posts were reserved for reserved categories. So being general category candidates, we suffered, then whatever it may be. So ultimately, the advertisement was there. I appeared in the interview, and in a month's time, there was an advertisement from AIMS New Delhi. There also I appeared, and I got selected in both the places. So I opted to come to Delhi rather than staying in Chandigarh. So I joined AIMS in the year 1993, October. So since then I continued there. I joined as assistant professor, then I got promoted to associate professor and additional professor, and then became professor. As professor, in the capacity of professor, I worked there for 8 years, teaching both MBBS, BSc Nursing, BMLT, MD students, and guiding PhD students. So after completion from there, so when I retired from there, then I went and joined in a Caribbean medical school. So that was my journey from my school days to my becoming professor and retiring from AIMS.
Then, sir, you served as a professor at AIMS, right, for 2 decades. Then you said you went to Caribbean. And what was the turning point that made you come to Nepal, here in NCOMS?
Yeah, that is a very interesting question. So I didn't even lose a day because I knew my retirement days are approaching, so I started applying here and there. So I got the offer in one of the Caribbean medical schools. It is actually a Dutch Caribbean island where I worked. But there I tried my best to have some clinical touch. Hospitals were there, but the students were not allowed to go to hospital and see the OPDs and patient examination. These things were not there. You only go as a teacher, you send your slides 3 days before your class to the student website, then they will be coming, they were all American students, they will be coming, seeing your lecture. More than seeing your lecture, they will be looking at their own laptop, the slides which you have sent 2 days or 3 days earlier. So this was the thing. So I was actually feeling like a fish out of water because, because teaching was there, but it was undergraduate teaching only, though they call it MD, but it was undergraduate integrated teaching. But this hospital attachment was not there. I tried my best. In the meantime, one day it was 11 p.m. there in the night and it was 9 a.m. in Nepal. So the then HR manager, he called me. Suddenly I got a telephone call, he called me. Then I told, how did you get my number? I got your number from your hometown, from your sons and from your relatives. So I am so and so speaking to you. Then we had a half an hour discussion. Then he told that, first thing I asked him, MBBS is there, I know, but do you have MD students in microbiology? He told, we have 5 MD students in microbiology. So he told, Dr. Sahab, you come one day, see, if you like, you join here, but do not like, you don't join here. So I came on taking some days leave. I came here. Then I saw this hospital. Then I found that it is, the infrastructure is good, and this is a new laboratory new microbiology laboratory where we are sitting presently. But we had our previous laboratory, which was also very good because it was built by all, all veterans in the field of medical microbiology who came from India and built the infrastructure there. You will be surprised, in the other room just in front of us, those huge number of chemicals which are lying there. It is not purchased by me. It was those chemicals which they had that vision. In fact, any bacterial isolate, we can identify up to species level without going to MALDI-TOF or any other advanced technique. Conventional technique we can identify, and in that way we train our students.
That's amazing, sir.
Sir, going back to your medical journey as a student, so what was your best quality that has made you like best out of best?
He mean to say some students are hardworking, some are really good at logics, some are really creative. So what do you think, what was your strongest domain, strongest quality? As you said, mathematics. So logic was also your top quality. So what do you think personally, what was your strongest quality that made you go through all these brilliant academics? So what was that?
Actually, this is actually, I am not boasting of myself, but this is my sincere advice and suggestions to students like you. You should have the quality of perseverance. You should not lose your patience. You should keep on trying. A human being, if he has the potential, if we try our best and keep on trying, then we can achieve our goal. It is not a miracle, but it is your effort which will take you to your goal, to achieve your goal. So that is the perseverance and your sincere effort, hard work to achieve that. It is not actually the genius. It is not the genius. I usually tell my students before their examination, Isaac Newton, the famous scientist, he told one day that Genius is 3% inspiration, God given, but 97% perspiration. The more you sweat, the more you gain. Hard work matters.
That's amazing. So his top domain was quality, was the relentless effort, the perseverance that made him go through all the academics, be a professor, top level professor. So that was the key thing. So as you said, sir, IQ doesn't matter, but I can matters. So, that was amazing. So now to the next question. Let's move on to the next question. If your parents could sit here today, and what part of your medical journey do you think they would be most proud of?
Actually, this is a very this is a nice question you have asked, which little bit I am emotional on that. Actually, when I was 13 years old, I lost my father, but it was a joint family, so I could study, complete my MBBS. So there was support from all where, but I feel very much for my mother, who sacrificed a lot. Rather, she was a great support in my hard work. So, as you were asking to become a professor, my mother didn't know in medical profession what is the meaning of a professor. She has the idea, professor, a doctor, being a professor, is a very highly qualified doctor, and he is a doctor at a very high position. That was because during my childhood, I am the eldest, and the sister younger to me, she had some chronic illness, and she was admitted in the same medical college where I passed my MBBS, admitted, and my mother stayed with her for a few months in that pediatric ward. And she, every day she used to see professor of pediatrics. He used to come with sympathy, with his hand. He used to touch the patient, console the parents, father or mother, whosoever is there. Mainly they were the mothers. And she was very much impressed. And everybody was aware of, they were saying that professor is coming on round. So everybody was supposed to, they were prepared as if professor is coming. So that professor word was in my mother's mind. So she not only wanted me to become a doctor, but to become a professor. Though she didn't really mean, she didn't understand the meaning of the word professor, but to her, professor is a big doctor. So you become a professor.
Please share us about one craziest thing that you and your friends have done in the medical college that will shock us today. That will shock your student today, sir. Can you share us one? Can you share us one?
Yes, every student in the student career is a little bit that happens. So that is a personal thing, very personal. But so Dr. Rath might be knowing because we belong to the same state. So in the city of Cuttack, there is a stadium. You might have heard about the stadium, Baravati Stadium, where international cricket events happen. So in front of that stadium, there is a huge ground. And on the bank of a river. That river is the biggest river, largest river in the state. So in that ground, from Kartik Purnima onwards, there used to be a Mela festival. We used to call it Bali Jatra. And during Bali Jatra festival, general colleges, they usually have 3 to 4 days holidays, but medical colleges also they declare holiday on request for 1 or 2 days. So that was a holiday. And me and my roommate, we had gone to see Bali Jatra. So we were moving here and there. And we took something that aloo ka masala, so we call it aloo dum. So we took it, but our hand was spoiled with the masala and that thing. So what to do? So we couldn't find nearby any source of water or something. So how to clean the hand? What to do? So when we used to find our friends moving here and there, then we used to embrace them, and we used their backside of their shirt as a handkerchief to wipe our hands. so that was very childish we did that. And also with friends, with the request of the friends, once I went on a picnic. Pathology examination was only 1.5 months away. So my roommate, he didn't go, but I went to picnic with the request of other friends. So, but there was a responsibility on me. One of our pathology demonstrators means he was a PG student, MD pathology student. So we used to regard him very much. So he had got some physiology hygiene. Physiology hygiene is used to be a paper in the high school certificate examination students. So physiology hygiene answer papers of the board papers, it used to be sent to the doctors for evaluating. So one of the professors got that bundle, and he gave the responsibility to our pathology tutor sir, and he gave me the responsibility to me to check that physiology and hygiene paper. So there was a time limit, but I went on picnic. So after returning from picnic, I heard from my roommate that sir was searching for me. Where is Niranjan? No sir, he has gone to picnic. So when he comes back, tell him to meet me. Then when he came back, I was so happy, jubilant after coming from then suddenly bad news he gave me. Sir came and he was asking for you. I'm very serious. He was very serious. Then I thought, then I couldn't sleep that night. Then the next day onwards, if I used to see him from a distance, I used to hide inside the post office, inside that block, inside that ward. But suddenly we met face to face. So I had to admit, sir, my friends, they compelled me, so I went, no, believe it. You come on this Saturday, we'll finish off that work, Saturday, Sunday.
Sir, it means you as a student were very famous at that time, like a lot of teachers will know you at that time?
Not really as a MBBS student, because we were 100, you were 100, now you are 300, we were 140 that time. And they used to teach us in one section, one hall. So excepting practicals, there were not much of interaction with the teachers. With some junior teachers, of course, we were close, but during my post-graduation, I was very close. Naturally.
Okay, so that was amazing incident that you used to avoid him, your teacher. I cannot even imagine. So let's suppose if we had time machine, so we are going to time travel a lot, sir, in this session. So if you could relive one day of your youth, one day, any day of your youth, what day would it be?
Of my youth?
Yes,
sir.
I should speak the truth, isn't it?
Yes.
Whatever. I was an intern, so just waiting internship was compulsory, 1 year compulsory internship. So during internship, we had that time, I do not know what is the situation now, but we had that we used to call it house surgeon's hostel, and all of us were allotted single rooms. So one day, as you were saying, it is the remembrance of my youth. So I had a girlfriend who was junior to me. She was studying in a famous women's college in Cuttack. Our medical college was the number one. That women's college was the number one. So one day she contacted through somebody that she has some eye problem. Because I am the intern there, so I can help her getting her eye checked up quickly without going through the queue, this thing. Because, so consultant, I can take her directly to the consultant. So after the eye checkup, then both of us came to our room. We gossiped, started, eye checkup was over by 10 o'clock. We forgot to take our lunch. We had long discussion till 5 p.m. When we realized it was winter, it was going to be dark. Then I told that we should go, your house it will take. So that was one day which I can remember.
Yes, really amazing, sir. As you said, it was all for a checkup. So I Jacob. Okay, sir. So, talking about you had girlfriend. So, was it love at first sight or what?
No, I knew her before.
So there is a trend and was a trend of staying in the relationship in the medical college. I have found that many of the students jumped in the relationship. So is it worth? What's your opinion, sir, regarding we should stay in relationship for any it will be helpful or?
There are many of our colleagues who were classmates, but they got married. Sometimes it is really helpful because if you are an anesthetist, your wife is a surgeon, then it is very very good combination. Then and also if you are a pathologist and the spouse is a clinician, also is very good. So that sometimes it is good. And also, it also sometimes is good for your studies also. So, it is not, if anybody is likes that, then it should not be discouraged. It is good.
Yes, sir. Noted, sir.
So noted, sir. Thank you for
Sir, so again, let's go to the time. Let's go time travel. Okay. So if we had a time machine and we walk into a studio, what we are going to find? The most likely thing: the posters, beds, guitar, books. So what we are likely to find there?
Yes, I remember we in one room we were 4 students staying 4 students. So I was in the window side. So there was one table, one chair, one bed, mosquito net, then one personal belongings inside the cupboard or inside a briefcase. But if you enter into my room suddenly, anybody enters, you will find more books on the bed than on the table. On the table, there were only few copies and one table clock and pens and nothing else. But most of the books were on the bed, and they used to be after me that you never sleep, you always study on your bed, you sit on your bed, you never sleep. I sleep, I also study. But I was very shy during those days, so I was not very much fond of playing outdoor crickets. Though I was playing volleyball, I participated in volleyball competitions, to some extent football, but not cricket. And indoor games like carom and chess, and few posters on the wall opposite to the study table were there.
So, sir, you woke up with books and slept with books.
Yes, yes. One day it so happened, it was pathology examination, was only 15 days ahead. So we used to study William Boyd pathology. William Boyd book is only one edition is there in the Deep campus. So there are beautiful quotes. Professor William Boyd, he gives beautiful examples of the pathological conditions in the various diseases. Examples from history, examples from mythology, those were written in his own language. So it is like a storybook if you read it with interest. So one day I was sleeping with the book, and the book fell down on the floor from the cot, from the bed. I knew it. During my sleep, I knew it that it is lying on the floor. Then I told her, whatever damage has been done, it is done already. Why I should get up now, get it at the table? I will get it. I will take it to the table morning when I get up.
Sir, you have decades of experiences on teaching. You have taught thousands of students. Among them, if I ask you one student, whose face you remember will spark you, sir? Who impressed you? Who that will be, sir?
Actually, it is difficult to say, but because there are many brilliant students we encounter throughout our teaching life. Here also in Manipal also there were many brilliant students. But if you ask me exclusively one student, I will say this student was not studying MBBS, neither she was MD student. She was a BSc optometry student. They were being posted in a microbiology laboratory for few months during their 4 years degree course. And during her posting, I remember I had gone to London for a month, and I did not interact with her in many on many laboratory techniques and procedures. But when I came back and I took her examination, whatever I asked, of course, within her syllabus, she answered 100%. And not only that, being BSc optometry, not even BSc medical laboratory technology. So she had that desire to complete MSc in microbiology. She had interest in microbiology. So MSc in medical microbiology. After that, I had gone to Chennai once on some examination. I saw her, she is doing PhD in a TB hospital, government TB hospital. She was doing her PhD in microbiology. So that is the one student I remember clearly.
So that was really surprising.
Yes.
The optometry student.
Optometry student going up to PhD microbiology.
Wow. Out of all those undergrads and postgrads from BJ,
Of any faculties.
Yes, sir.
And I interacted her in her lab when she was doing PhD. She told that she has a vision to go to Australia. She might, now I have lost contact, might have gone to Australia.
Okay, sir. Next, that was really nice. So, what is one thing that you have never told your students, but you wish they would know about you? What is that one thing?
Yes. Actually, everything you cannot reveal to the students because it is not nice also because you speak about yourself without being inquired about it. One day when I was presenting my first slide of my lecture, my name was there, my qualification was written. So one student after the class, your senior, he asked me, "Sir, what is this deep NB? MBBS, MD and deep NB." That is also a postgraduate degree, Diplomat of National Board. That is one National Board of Examination in Delhi. That is also a postgraduate examination, similarly clinical vivacious theory. So I told that this is an additional postgraduate degree. So many things you do not speak about yourself. If you are asked, you can speak. But one thing I desired to speak to the students, but I have not told, that during my student career, as a postgraduate student in Chandigarh, PGI Chandigarh, I got a medal for the second best thesis work in the institute. I got a silver medal, the second best. So it depends upon your passion for the study, your hunger or your longing or your eagerness, whatever you can say. All these things matter. As a student, you should also achieve. Nobody is preventing you.
Okay, sir.
Sir, what was one hardest question you were asked by the student and you pause and think like, I need to read more. You
Tonight.
went room and read.
You thought I have to do a lot of work tonight.
You open lot of books to source answer.
These 2 times I have faced. Once in Nepal, a candidate didn't ask, but I was the examiner, and the candidate was appearing MD Microbiology, Institute of Ophthalmology, Maharajganj, Nepal, and there was some argument on some key point on the identification of the bacteria. So he insisted that he was right.
So
That was a good question.
Yes, very good
You
question.
responded nice also.
Yes.
now, sir, if I gave you a time machine to relive one lecture or moment, Which one would you choose and why?
One.
Lecture hall moment. Lecture hall.
Okay, lecture hall. Okay, lecture hall moment. Okay. Very interesting thing I can tell you.
Yes.
So again, my days of PGI Chandigarh, we were MD students. So there used to be journal club on Saturday from 8 a.m. to 9 a.m. every Saturday. Journal club, it was being presented by faculty, students, everybody, starting from HOD to the junior most MD student. So that time the projection, that overhead projector we were using, not the slide, overhead projector, the lights were to be switched off, and from that overhead projector, either card or those other type of slides we used to prepare with that plastic device. So those were projected, and in that the lecture hall was dark, and we used to concentrate because it is a journal club. Seminar, it is a flat topic, you can read and you can understand everything. But journal club is new, somebody else's work, you have to understand, and one of your colleagues or seniors is presenting. So you have to concentrate little more to understand the thing. So one of my friends, one day what he did, he took a small photograph of a girl and put it inside my white coat pocket. Without my knowledge, because I was concentrating there, so I didn't know he put a photograph in my pocket. Then after every seminar or journal club, we used to go for a cup of tea for half an hour. That everybody knew.
Was there ever a case in your research or patient care that left you completely speechless? Like you were surprised by microbe. You don't know, or like there is something unique microbe is appeared in the microscope. Was such kind of incident happened in your experiences, sir?
That made you question your abilities, right? Everything that you've learned of it.
Not microbe. I was not surprised by microbes, but I was surprised in my patient care. Actually, I was working as a general duty medical officer after my MBBS. So it was a rural area, a coal field, as I told you earlier. So it was a surprise by microbe in one way. It was a surprise by microbe. But as we are thinking, surprise by microbe means microbe will be causing some damage, causing some injury. But it was the other way around. Microbes were silent. So the interesting case was that it was a very remote area at 2 a.m. in the morning, in the night. A patient was brought onto the emergency with injury. Injury means it was a sharp cut with a sharp knife. There was a clean cut incised wound starting from the giphisternum till the anterior abdominal wall up to the umbilicus. Such a long clear cut incision with a sword or with a knife. So he was brought. Then after I didn't have any time to complete the formalities for the police verification, but it was done. But first and foremost thing was my duty was to take care of the patient. There was bleeding, so I took care of the wound, and whatever facilities I had, I stitched the wound. It was a clean inside wound, so stitching could be done. So, but I was always apprehensive that in this remote place, without proper sterilization facility, whatever resource I had, I applied. Then I stitched. Then I discharged the patient. Then I followed up the patient for 7 days. There was no wound infection at all. Microbes surprised me. Not even the normal commensal flora of the skin, they could get the opportunity to colonize there and or something. It was a clear, very good incised wound, and I removed the stitch. It was healed properly. That was a real surprise for me.
Wow. So, sir, as you said, so during that time, in house or whenever, you used to think of that thing, right? Scenario. What would happen to that patient now?
That patient, I was there. That patient used to come to the hospital for other ailments. I used to see that patient. Follow-up was done.
Okay, sir. The next question is, people who are deeply in love with something, they see it everywhere. Some see God in everything, okay? And some who are in love, like him, see that God in everywhere. Suppose Einstein used to think in equations. So sir, you have devoted your life to microbiology. Every time, right? So you have been in lab, so through the microscopic lens, you are seeing microbes, you are solving cases. So, do you feel the same? Do you experience the same?
Actually, I love my patients, but I hate the microbes. so that is why I do not see them in my dreams. Neither I think about them when I go to my house. Neither I clearly disinfect my hand before going to my house, and I tell my students also to do the same thing. So that is why I never see microbes in my dreams. Rather, the other options which you have given in the question, dreaming these things, lively things, something, I dream. When I sleep with a dim light in my house, so I see beautiful dreams with beautiful smiles. So I see that.
So
Not microbes.
That's really surprising, sir. I never thought that. I used to think you see microbes in everything. Suppose while washing hands, everything.
You were thinking about like microbes at that time.
Like, so it is really surprising to me. I am really speechless.
Sir, everyone makes mistakes in life, and mistakes needs to be there to learn, to get success or to become expert also. So, what is that one mistake that you have done in your past that turned you to be the greatest teacher, sir, or greatest microbiologist?
Yes, that is also another important thing. So long as you are having some responsibility on your head and you are discharging your duties with responsibility. So before that, I must say that if one must learn from the mistakes, because mistakes are the milestones on which you learn many things.
Yes.
So acknowledging that mistake or reviewing that mistake, why that mistake happened, that gives you a lot of courage to face problems in future. So many such things have happened in my life, and before coming to academics in PGI or AIMS, as I was saying, I was a general duty medical officer for some time. So there, I have found some problems by trusting somebody. So from that day, I promised that without any evidence or without any support, I should not trust anybody, and I should not blindly sign a paper if you say that it is okay. So that thing I have learned in my life, and I do not want to reveal much details about that. That person was doing something by putting the attendance of somebody who was on sick leave, but he was not actually present in the station. He left the station, but he was being marked in the plea that he is being issued medicines. So I have seen that was a gross mistake on my part. So it was a person who was actually not present physically at the site. So that should not happen. Then I advised all my juniors to look into that. That should not happen. I was too young. Just after MBBS I joined that, and those who were around me, surrounding me, they were all they were present in that situation. They were grown up in that situation, and they knew those problems. So that was a mistake. That was something I learned in my life.
So, have you ever been scolded during student life by some teacher in school life or in medical life, like you did something wrong and they tried to scold?
Yes. So many times during my PG, MD 3 years, scolded. Yes, definitely. But I took it very boldly.
Yes, sir. It should be taken very softly, sir, because they are also important.
Yes.
Otherwise, no one will.
And that was mistake. That's a mistake.
That
So
was mistake.
I scolded.
And that is part and parcel of this medical.
Yes.
So, sir, when you look back at your life, at your long career, what makes you think, yes, I have lived my life. I have lived my life, I have solved my purpose. So what's that thing?
But to be very frank, I never look back. So I always look how to, till now also, I am thinking that if I leave Nepal College of Medical Sciences, I will find a place where there is no age bar and I can work till my health permits. So I never look back what has happened, but I always look forward, so that and I think about the present moment and I plan my future.
So that's good, sir. The whole the principle of spirituality is to live in the present that you are doing. So that's awesome, sir.
Sir, most of the people retire at the age of 16, right? So you were more than that, and still you have same energy, sir. You woke up in the morning and running in the wards and teaching students. So what is the motivation behind this reason, sir?
Actually, main motivation are the students. And I loved to come this place. When I came to see here, I found that had I opted for teaching only MBBS students, I would have got much higher pay in India or some other country rather than coming here. But it was the passion for teaching the postgraduates. That is why I stayed here. So every morning I woke up, I always think it may be little embarrassing for the student, but it is good for the student. I always think rather whatever the presenter presenting the seminar is preparing, I read more than what the presenter might be studying, in order to pull the legs, not because to harm anybody, but to make him or her learn the things. So that makes me attractive, that I come to with a fresh mind every morning, so that this thing I am going to discuss, or this thing I am going to teach, or this book I am going to show. This is my plan in my mind. That inspires me every day, even if I have crossed the age limit of
That's amazing, sir. It means learning never stops. You love to teach the students too. And we could see, sir, in classroom, whenever you ask question, you are too eager to hear the answer. No matter, it might be wrong, but you are too eager. The curiosity in your eyes, the sparkle, the sparkling. So that is what impresses us, amazes us. So
We can feel it.
Thank you so much.
really, sir.
So you are really connected in Pokhara environment.
Yeah.
So are you enjoying Pokhara, sir?
Yes, very much. From this time onwards, it will be going on becoming colder. I like this cold environment. There's low temperature without any pollution, dust-free air.
Nepal is like similar to India, so environment friendly.
That social environment is similar to India.
Yes, sir.
So now, sir, next question. We have seen microbiology, medicine evolve over for decades, right? So again, let's do time traveling. Suppose if you had the chance to meet Louis Pasteur, let's say, or meet or WhatsApp him, so what would be the message that you would like to send him?
You mean if I go to the past,
Yes.
the time when Louis Pasteur was working?
there.
So message means that time this WhatsApp mobile it would not be possible. I would only write a letter or something.
Suppose if we had chance of time traveling, or you could WhatsApp from here. Let's say, imagine he is receiving the message.
Okay.
What would that message be?
The main message would be, Dr. Louis Pasteur, are you sure the 9-year-old boy whom you administered your recently invented rabies vaccine, he was bitten by a dog. Are you sure the dog was rabid? Or you just experimented on him? How are you sure that the dog was rabid? You would have observed that nothing is mentioned in the history.
Sir, with
I think you are not. You are still
Satisfied?
thinking about the answer. And if I go to the past,
Yes.
I would have asked him this question:
Yes.
How are you sure? How you are sure that the dog was rabid? That you administered a vaccine which has not undergone any trial. You directly experimented on a human subject. Of course, the argument would be
yes, sir.
anyway the boy was going to die. But how you are sure that the dog had rabies virus in its saliva? Was the dog rabid?
Yes, sir. Maybe the rabies was confirmed after once the consequence was there, after the child may died, and he might have gone many clinical like examination he have seen. By seeing the patients like somebody.
But it is an emergency.
Yes, sir, it is an emergency.
Mother brought the child bleeding from the lower limb
Yes.
and being severely bitten by the dog, and he administered the newly prepared vaccine, spinal cord vaccine from the.
That is good question,
That
sir.
is
Neural
a point to be noted.
Yes, sir. Point to
I
be
think you would left the message unread.
He is a great
Yes, sir.
father of bacteriology. That is.
Obviously, he's great. That's why we mentioned him in
Yes,
this.
yes.
So,
Not only rabies, he has worked on so many things. Attenuation. The
Attenuations.
concept came from Louis Pasteur.
yes. Sir, with developing modern and AI technology, as we know, the classical microbiologist used microscope for diagnosis and observation of microbes. So do you think in future that will hamper the microbiologist profession job, like such kind will be affected, or you do believe there should be manual or human should be there for operating and diagnosis? Is there any
How the artificial intelligence affects the microbiome?
microbiologist?
I have not in-depth knowledge about artificial intelligence, but whatever basic I understand, artificial intelligence can replace microbiology in the fields of identification of microorganisms, antibiotic sensitivity testing, even molecular typing, amplifying the genes. Everything artificial intelligence can do. But artificial intelligence has got its limitations, that up to the level that whatever data you have kept in the artificial intelligence, it will interpret that data only. But human brain, if you think, it has got its intuition, its imaginative capacity, its decision making it is not limited. So it depends upon many other factors. Human intelligence, whatever human intelligence has failed to the artificial intelligence, that will work in that way. It is its limitation. And for interpretation of data, always human thinking is what is required. We are having so many automated devices for diagnosis also,
Yes.
but still then you need interpretation. And for evaluating a student of medicine, artificial intelligence is not sufficient enough for judging the caliber, the skill, the technical know-how, the laboratory methodology, application of the methodology. These things only a human brain can judge.
That's really nice to hear, sir. Sir, in medical sciences, basically we divide subject in clinical and non-clinical subject. We have heard, and sir, you choose microbiology. Sir, there is any other subject that you have more interest after microbiology? If you have to tell one subject, what would be, sir? One subject.
Other than microbiology.
Only one subject.
Yes.
Anatomy.
Anatomy. You really like anatomy,
Yes,
sir?
yes. Because in many invasive infections, before explaining to the student, I go to the depth of the anatomical structures in relation to that Say for example, a little 2 minutes more. Say for example, your during COVID time, people called it black fungus because there was brownish thick nasal discharge from the nose, which because of the erosion of the blood vessels, it was blood tinged, and when the secretions become old, it looked black. But the fungus is not black.
Yes.
Calling the fungus mucor, Rhizopus mucor, as a black fungus was a misnomer by certain sections of the scientific community. It is not a black fungus. Black fungus and they are separate entity.
Yes.
So that you will be surprised that mucor rhizopus, it is not new during COVID time. Because of administration of steroids, the patient became immunocompromised. Patients became immunocompromised. That is a opportunistic fungus. But when the fungus, it goes by inhalation, goes to lower respiratory tract, but some may lodge in the paranasal sinuses. Paranasal, if you do not understand the anatomy, you cannot understand the spread of mucor through to the brain, causing cerebral mucormycosis or cavernous sinus thrombosis. The ethmoid bone, which forms the lateral boundary of the orbit. So once the ethmoid sinus is involved, through that boundary between the ethmoid sinus and the orbit, there are foramina through which the emissary veins passed, and through those foramina there can be direct contiguous spread from the ethmoid sinus to the orbit. And the veins draining the orbit to the cavernous sinus, they are valveless. So these things will be taught by anatomy only to understand the pathogenesis of many diseases. Robert Koch, when he studied about pathology of tuberculosis in the lungs, unless he would have known the detailed anatomy of the bronchi, bronchioles, acini, the alveoli and the surrounding blood vessels, it would not have been possible. So anatomy actually solves the base.
Yes, sir. Anatomy is important, and a lot of students, including me, find anatomy slightly difficult, sir.
So it was a no to me personally.
I faced the same problem. Our professors used to say, you have to read Gray's anatomy. But it is so difficult to digest Gray's anatomy for an MBBS student. Anatomy is tough.
But once understood, it is
Yes. That is very right. Very right.
We have to reach the place first, sir.
Yes,
Understand the
yeah,
frameworks,
yeah,
the checkpoints, everything.
Then we'll understand physiology, pathology, and everything microbiology later on also.
So anatomy is very important for students.
This is
Focus on
point
the
to be
basics.
noted.
Okay, sir.
No.
Now let's move on to the rapid fire segment.
Okay, before moving to rapid fire segment,
Yes.
let's ask something like, what is your contribution regarding research? You have you have wrote many articles.
Over hundreds of
Yes, sir.
articles.
You can mention in the video, sir. Tell us about that also. You have taught a lot of students. What about the research part? You have written many articles,
Yes,
right?
yes. You mean to say one is article that you think that is your best work, that you are really proud of. You have over hundreds of research articles. What is that one research article? What is the concept? What is the topic that you are really proud of?
And when did you start
Yes.
to write that articles? At what age you first started to write research paper, and
Most
recall
exciting.
one most exciting and like such a research article you feels like it was very good.
Yeah.
One of my study was published in Journal of Hospital Infection. It is a very standard journal. So the paper got accepted only with one. I still remember I was in AIMS. So one reviewer, he straightforward accepted it. The other reviewer had only two small questions, because it was actually an original work to evaluate Staphylococcus epidermidis forming biofilms and that quantification of that biofilm and its relationship towards antibiotic resistance. So that quantification of that biofilm, that methodology, it was our original method. I thought that it would be straight away rejected, because why they will go to the details and study, because usually you find that they prefer authors from other places, but it was accepted, and that is, I think that is one of my, I was very happy after that publication, Journal of Hospital Infection. Its impact factor is quite high.
So how many years back? Because
It was in early 2004 or 5, 2005, 2006.
and sir, what is your relation with ex-president of Nepal, Dr. Niranjan sir?
Yes.
There are some.
Okay. He was our senior colleague.
Yes.
He also did his MD from PGI Chandigarh. So we were staying in the same hostel. So and he forgot my. He didn't know me properly because I was 3 years junior to him. So 3 years in post-graduation is a long difference. But there were some seniors who used to say, call him Yadavda. So when I came to Nepal, then he was at that time he was president of Nepal. So once I went MD examination into IOM, so I tried to contact him, but appointment could not be obtained. So then I could not meet him. Then after a few years, I again went to IOM. That time he was just member of parliament, but not president. So that time I could telephone him and get a time and go to meet him. So he told that since how long you are here, then he started talking me in Bengali, because he passed MBBS from some university, some medical college in Kolkata. So he speaks Bengali very well. So he told that, why didn't you meet me at that time? I told, sir, I couldn't get appointments. So he told me that whenever I go to Janakpur, I will go via Pokhara, I will meet you.
He also calls in Lalitpur. He right now is in Lalitpur.
His house is in Lalitpur.
Yes. And
sir, you mentioned the other day some incident during convocation.
convocation related.
We called you among the group.
Okay. Not me. That one of my colleagues who was more close with Dr. Rambaran Yadav. That time I was in Nepal. That time the same colleague, he was HOD of microbiology in PGI. So he only invited Dr. Rambaran Yadav to the convocation as a chief guest. So from amongst the crowd he called him. So everyone was surprised. The president of Nepal, how he recognized you, he's calling you. So he was narrating me that story. And all of us met in Dr. Yadav's house once a few years ago, when the same colleague whom Dr. Yadav called from amongst the crowd, the same colleague visited NPHL on some fungal mycology workshop. Then I had also gone in the context of examination. So all of us were together and went to his house. And we had a very fabulous, nice dinner in his house.
He is a frank guy.
Yeah.
Yes.
And sir, what was your nickname? By what name they used to call you?
Yeah, very nice. Actually, my friends, they call me either Niranjan or Niro. Nira, Niro. But 3 of my friends, my medical college MBBS classmates, 3 of my friends, 2 ladies and 1 gentleman, they call me Niru. So, and one of these ladies, she passed away 3 days back. She used to call me Niru. She passed away.
Nice, Niru sir, such a cute name. Sir, can we move to rapid fire segment now? Okay.
This is our last and interesting segment, sir.
Okay, thank you so much.
Yes, sir.
It's really exciting. So, question number 1.
Question, yes.
If you could keep one bacterium as your pet, like people keep dog or cats at their home, if you could keep one bacterium, which one it would be?
Lactobacillus.
Lactobacillus.
God.
And why, sir?
Because it is part of the food.
So that you would eat cod more.
It means you like God, right?
If bacteria could give motivational speeches, motivational speaker, which one of them would be the best, most inspiring speaker?
Escherichia coli.
Wow.
Why, sir?
Why, sir?
Because it has got diverse way of pathogenicity.
Oh.
It can cause diarrhea, it can remain as normal flora, it can cause urinary tract infection, it can cause bloodstream infection, it can cause meningitis in neonates.
So next question. What is the most underrated microbe that students never pay attention to, but you think they should?
I could not get.
The most underrated microbe that they overlook, that they don't give attention to, but you think they should pay more attention to that microbe. What's that one microbe? That really did.
Which is one that microbe that get ignored by students, and you think that need to get more attention.
More spotlight.
Spotlight. What is that one microbe?
Students don't pay attention means it could be for the academic purpose.
Yes, sir.
That this is the least important for
Yes,
our
yes,
examination
yes,
point
yes.
of view. Yes, there are like Clostridium botulinum. Then they hardly study about that. But when they come to the clinical side, they face the problem because botulism is very common in infants, and botulinum toxin is very potent toxin.
Yes, sir.
So there are many topics in clinical microbiology which students do not pay attention to.
So, sir, the next question. What is your favorite microorganism? Most favorite?
Staphylococcus epidermidis.
Oh. It is like not a flora.
But I have worked a lot on Staphylococcus epidermidis.
As you just said, you some article. So, if you had not been a microbiologist, what alternate life would you be living right now?
But I would have been a specialist, definitely, in some other subject, because after MBBS I was curious to go for post-graduation. In fact, I was selected in orthopedics also. But I do not remember what forced me to come to microbiology.
So, if you had the chance to have a dinner with one scientist, either dead or alive, who it would be? He or she would.
Alexander Fleming.
Penicillin.
So, if you had to write your own autobiography, what would be the title name?
Man, Machine and Microbes.
Nice. Because I had seen that the man, the myth, the microbe. It would almost same. So, suppose there is some concept of afterlife in Hinduism. So, if suppose if you were to reincarnate in some bacterium or any other microorganism, which one would you choose? Suppose God said, okay, now I give you options. You could choose any one, list any one. Okay, say any one microorganism. Which one would it be?
I will prefer nothing.
If you had to.
It's a B not flora.
Then fungus.
Which one, sir?
Fungus.
Sir, bread mold.
Some molds which are harmless. There are many environmental molds which grow on tree trunks. They are harmless. So I do not like to cause harm to the population, either animal or human population. Silent, just parasitizing on something.
Okay. Any names or any species named to be specific? It's really hard question.
Okay, in that case, if you would like to name some fungus, then it could be Saccharomyces cerevisiae, not a mold, but an yeast. Again, it is a cord-forming yeast.
Yes. You really love cod, I think.
But every day I take cord in the morning.
So, sir, you have taken thousands of bypass. So, what is that funniest answer that you have ever heard? That you still laugh whenever you are reminded of that answer?
you caught student like doing cheating and like they are pretending to answer you and this they'll tell something different.
Funniest answer.
Honest answer, sir.
Funniest answer, give an example of zoonotic disease, malaria. Why? Because it is the answer is it transmitted from mosquito man. Then my answer would be, if mosquito is an animal, then dogs and cats are insects. Zoonotic means coming from animal to man.
Yes, sir.
So why are you saying it is the funniest answer? Why are you saying mosquito to man?
Really funny, sir. So next question is, it is a choice rather, which is more dangerous, antibiotic resistance or heartbreak? Antibiotic resistance or heartbreak? Heartbreak.
Relationship breaks are that type.
Which is more dangerous?
More dangerous for survival. Which is more dangerous for survival?
Heartbreak.
Have you had any heartbreak?
I didn't have. I was contented with whatever I got.
Okay, sir. So now, so you have been playing guitar, learning guitar for over 4 years. And now, what's your all-time favorite song? And
Next question is, you would like to sing me a song now?
yes, sir. First time we want to know about your favorite song. Then obviously,
If
we would love to hear you sing.
Yes, sir.
I have learned many songs.
Yes.
But,
Song that you listen most frequently.
Song we listen most. Maybe we have not heard that song. We'll search today.
okay, you must not have heard, because it is a song of our student days.
Yes, sir.
But still those songs are still evergreen.
Okay, sir. We'll
They
search.
were very famous musicians of music directors.
Being a music lover, to pick a one song, it is really difficult, sir. So, yeah. The song maybe that takes you back to your youth days,
Yes, sir.
nostalgic. I think that would be.
So, like me to sing song now?
Yeah,
Yes.
we would love to.
We would love to hear you, sir. Why not, sir? If you are comfortable, then we are definitely eager to.
Just 2 lines.
Okay. Can you give me 1 minute?
Okay,
Okay, sir. We will edit this.
की हुई यादें मुझे इतना ना सताओ, अब चैन से रहने दो, मेरे पास ना आओ, भूली हुई यादों मुझे इतना ना सताओ, अब चैन से रहने दो, मेरे पास ना आओ, भूली हुई यादों, दामन में लिए बैठा हूँ टूटे हुए तारे, टूटे हुए तारे, कब तक मैं जीऊंगा यूं ही ख्वाबों के सहारे, ख्वाबों के सहारे, दीवाना हूँ अब और ना दीवाना बनाओ, अब चैन से रहने दो, मेरे पास ना आओ, भूली हुई यादों।
Wow. Sir, that was very nice, sir.
We loved it, sir. We
Oh
loved it.
my God. Sir,
The lyrics are too deep too.
I never imagined like, sir, you have such energy. This song is really difficult, sir. You need to, you have singing high pitch, sir. Wow. Unbelievable, sir. But
So you are learning this song in guitar too? Guitar.
Not this song, but there are many songs which I have learned in guitar as well as in vocal.
Sir is taking daily guitar classes too at this age. So he's too eager, always ready to learn, always eager to learn. So that is one quality that every one of us should have. So that's really amazing. So sir, what's the song name? This song?
Song name is Bhuli Hui Yadon, and it is a Hindi film Andaz. Andaz with star was, I think, a very old actor. Pradeep Kumar. Pradeep Kumar was the actor.
Any specific memory events related to this song?
It is a sad song.
yes, sir.
That some situation is there in the film that he is singing this song while taking a glass of wine or something, singing this song, and he sees the the beloved for whom he is singing the song. He can see the image in the inside that bottle, and seeing her, he is singing the song.
That's big.
It's lover kind of thing.
Very meaningful song.
So heartbreak is more dangerous than antibiotic resistance.
Yes, concluded, sir.
I can get that too. So sir, now talking about movies. So what's your favorite? Who is your favorite actor and actress?
Actor is Dilip Kumar.
Yes.
Actress is Wahida Rahman.
Wahida Rahman.
Wahida Rahman.
It was short time. Sir,
Our time.
if you talk about today's time,
Present time.
who it will be?
Present time is
Actor, actress.
that is Shahrukh Khan.
Shahrukh Khan.
And
Really difficult choice. His favorite is Nora Fateh.
Who is Nora Fateh? I don't know.
Very difficult, I think.
So, Deepika Padukone.
Katrina Kaif.
Priyanka Chopra.
no, what is her name? Shakti Kapoor's daughter.
Shraddha Kapoor.
Shraddha Kapoor.
So that was my favorite from class 8. Really, sir. Same choice.
Same choice, sir. Actor also, he likes Shahrukh Khan very much, sir.
So my favorite is Shahrukh Khan too, and favorite is Shraddha Kapoor. Same choice.
It is not scripted, right?
No.
Because sir and your choice is same, it means it seems like slightly scripted, but it is not scripted.
I will show the images later.
Okay.
Okay, sir. Any one question you would like to ask?
Regarding current scenario, sir, related to sports, cricket has been one of the most famous sports. So, who is your favorite cricketer in your time? And Kapil Dev was your all-time favorite cricketer.
Yes.
Do you still follow cricket now?
Yes. Today there is India-Pakistan match. Tomorrow.
Yesterday, India versus Oman.
Oman. But today there is again good match, Sri Lanka and Bangladesh.
So, don't you like current generation cricketer? Do you follow cricket now?
Sure. Cricket I glued to the TV.
Oh.
I never go anywhere.
Wow.
Only
Whenever
cricket.
there is cricket in an international event, I never leave.
So you follow IPL too, sir? Then IPL.
IPL is good, but you cannot support anybody.
That's the
Mixed up players are
That's
mixed
the
up.
question we are willing to ask.
It is also being recorded.
Yes.
Yes, it is recorded. There is one famous cricketer, sir, Kohli. Do you?
Virat Kohli.
Yes, sir. Do you like him, sir?
Ah,
He is chess master, sir.
yes.
But yeah,
He has won most of the matches as when he captained. Also beyond his captainship also.
So, sir, other than cricket, so when you are bored, what you do other than playing guitars or watching cricket?
Cricket matches are not every day. So I play guitar. Then actually nobody teaches me to sing song. I practice it from the YouTube. Whatever songs I like, I repeatedly. If you repeatedly practice it, and if you sometimes you have your voice will break,
Yes.
which will be very bad thing to nobody will like that. So that you have to be very careful, and so one can learn.
Yes.
And then I started learning with the Koraki music.
Yeah.
Along with the music, you have to sing in such a way that music finishes and your voice starts.
Yes.
So
Yes.
then I recorded and I learned. Then I learned the mistakes while you sing the recorded voice. I'm not a singer, but I can manage in some small get-together parties, something like that.
you love music, basically. You love music.
Singing is a technical skill, means we can train it, the vocal cords.
Yes, yes.
We cannot be gifted, but
You may not be gifted, but you can.
to decent level we can do
Yes,
that.
to a level. Yes,
Yeah.
correct.
Sir, how many languages do you speak, sir? You can speak how many languages?
Odia, my mother tongue,
Yes.
Bengali, Hindi, English, and there is one Didi in our media preparation room. She never speaks English, never speaks Hindi. So, but I have so many works with her. So she has made me learn Nepali,
Wow.
to speak Nepali.
Which means
Five languages.
5 languages. Too much. So, sir, thank you for this awesome opportunity. It was totally unfiltered. We felt as if we talked as if there was no camera. So it was really refreshing, and this is the moment that we will cherish forever. In decades after we took this interview, and this is a really historic moment for us to take an interview of such a renowned professor. So, sir, thank you for this time. It really means a lot.
Okay. And can I ask one, two more questions?
Okay, let's end it with the questions.
Sir, you have visited many places in Nepal, I guess, in Pokhara also. What is that one famous place or one place you really enjoyed?
Chitwan.
Chitwan, sir. Chitwan Safari.
Yes, safari I have number of times I've gone. Jeep, elephant, but excepting maximum rhino. Tigers. One day I thought that if I ride on elephants, elephants will go to the dense forest, so I can see tigers, but nothing happened. Only limited to rhinos only.
Sir, choose one between mountains or beach. Which area do you prefer to?
Mountain.
See, mountain. Always mountain. You can see mountain from here also. So you are in Pokhara, sir.
We can see the yaks to here.
Yes. This is the picture of Johnson.
Mustang, yes, sir.
Mustang.
Yes, sir. Johnson, yes, sir. Sir,
One of our PG students, she gifted this.
oh, yes, sir.
She is now in KIST Medical College. She is a faculty in KIST Medical.
Really nice pictures.
Sir, what is your favorite holiday destinations you would like to visit?
Next.
Like, not about Nepal and India, beyond that, like in other countries, you have traveled a lot. What is your favorite destinations you would like to prefer visit again? Or you are willing to visit for first time? Is it
Favorite place is London.
London?
Because I stayed there for a few years.
Oh.
I liked very much. and their tube rail is so fantastic.
Tube rail.
Tube rail, that like our metro in Delhi or Kolkata, tube rail,
Yes.
London tube rail. So once you get the map, you can reach anywhere. You can come back anywhere from anywhere. Connecting train from which station, which line you. Very well organized in London. And in London proper, you will never find dust. Never. Not a dust particularly. And for the duration for which I stayed, I forgot that there is some diarrheal illness or I forgot it totally. When I came back to India, then it appeared.
How many years you stayed there?
1 year, few months.
So,
And-
sir, the closing question is, who is your inspiration?
Yes.
Who is your idol, sir?
That we missed the most important question, I guess.
Yes. When you are child and throughout the journey,
Could be any personality or figure.
not you can just mention one, you can mention many of
Or any
them.
family members.
Who is made you everlasting impact, sir?
My inspiration during my schooling was my grandmother. Her idea was that if a child wakes up at 4 a.m. in the morning and studies, he will remember much more than a child who is getting up at 7 a.m. and studying after that. So I used to sleep with her, and she never used to allow me to sleep after 4 a.m. And she didn't know much about this my study, my curriculum, but she used to ask me what you have done, how much mark you will get. She was really an inspiration during my schooling. In college life, inspirations are your friends. You compete with them. Then,
Yes, sir.
right?
We try to push ourselves by looking the friends.
Healthy competition.
And
Yes.
you really choose a great inspiration, sir, because most of us think that we need to choose our idol on the same field. It is not necessary. No? We can choose. You choose grandmother, and she told you wake up in morning. That is a really nice suggestion, sir. We can feel it, sir. Any
And
questions?
that habit I am still continuing.
Yes, sir. That's very
You woke
good.
up at 4?
Yes, I woke up very early in the morning, and most of my WhatsApp messages, my email to my juniors and my students, they surprised. You are sending the message at 5 a.m. I get up at that time, and that you send message at 5 a.m.
So the childhood habits remain
it's-
lifelong.
yeah.
Sir, what is that one message that you can suggest us or our colleagues or those who are willing to join medical? What is one suggestion you can give us so that we will be the good doctor, great doctor? So what sorts of things we should look on during this phase, sir? We have not idea.
See, actually, in this institution, the purpose of our training is to prepare you as a medical teacher. You may, after your MD or after your MBBS or after your MSc or MS, you may go and have practice and earn money. But the curriculum is so designed, I'm telling you about postgraduates, that we are trying to make you teachers. Okay. So, to train you as a teachers, we are giving you journal clubs, we are giving you seminars, we are giving you case presentations. So, to train you as a teacher. Okay. So, that starts from the MBBS level. So, my suggestion is that for those who are opting for going in teaching profession. So if you are a teacher, be a good teacher. There is another terminology called goody teacher. Goody teacher means Rath, what is this? Then he says something, okay, whatever he says, okay. You read from this book, then smile, they say, this is not the way. If you interact properly, so that he remembers the thing. if you are to be harsh to the students, you have to be, because you have to build up, not that you leave that thing upon him. He will never try to get that unless you criticize. This is called this criticism is actually needed. Constructive criticism is constructive criticism, and students may take it otherwise, but you should convince your students that as a teacher I should tell you these things.
Wow, sir,
Very good
that's
suggestion,
really
sir.
amazing suggestion. We should not take any harsh comments personally.
We need to find out positiveness from everything, sir.
Acknowledge that it is just meant for our benefit. So
Wants to understand this.
thank you, sir, for this lovely time. We spent this time hours with you talking this. Sir, really amazing, right?
Really amazing. Why not?
Few times camera went off, memory was full. Okay, so now we are recording in the mobile phone, and you are smiling evergreen, sir. I think this will be remembered forever. So this is really a good memory. So thank you, sir. Amazing. We wish you great health.
So you are in sixth semester.
Yes, sir. Okay, thank
So,
you,
so
sir.
God bless you, sir.
Thank you, sir.